Everyone, it's Michael here at homehealthsuccessacademy.com and 10xpatientreferrals.com. And what I want to do is share with you guys some of the most important things that as a home health agency, a home care company, things that you guys should actually do to create a successful business. And what we want to be able to discuss with you guys are 11 points that you guys need to have within your company in order to be able to have a successful company, right? And in this video, we're going to share with you guys one of the most important things that you guys need to be able to have within your organization. And that is having higher standards and regular training for your team, okay? So, in our company, Home Health Success Academy, we consult agencies on how to be able to increase your referral sources, which in turn increase your profit and your patient census, okay? And so we're going to talk a lot about having high standards and regular training for your marketing team, but these are things and ideas that you can actually incorporate into your organization for your office team and for your field staff, like your nurses, your caregivers, your therapists, okay? So let's go ahead and get started. All right, so I want to share this with you guys. Only 10% of the population has the learning mindset that seek out and enjoy learning. 10%, right? So I will tell you guys one thing is that I hated school. So I was not that 10% of the population that had the learning mindset. You put me during English Lit and my mind is pretty much looking out the door. You put me during history class, and I am paying full attention to the teacher because I love that information. Okay, so the thing that we need to understand is that only 10% has a mindset that seeks and enjoy learning. The other 90% will not look to improve their skills unless they have to as part of their job requirement. So nurses, for example, are starting to have to do what they call CEUs in order to be able to renew their licenses. But the funny part is they're trying to do the easy CEU classes because they just need to get it out the way. Now, here's the fun part. We all should be learning something new in order to be able to how to better ourselves. Learning something new, learning a new skill is good for our brains. And so I did not enjoy learning stuff in school as much. I went to nursing school. I enjoyed nursing school. So I did well there, but at the same time it all depends on what is your why. And so as a company, we need to make sure that we handle these different things, that everyone is provided training so that they're updated with everything that they need to learn. Your nurses should always be trained. Your caregivers should be given, orientation. I'm not just talking about these required by your state, required by CHAPS, required by JCO, in-service training. And sometimes there's a lot of companies don't do a good job doing those in-service training. They just say, hey, here's the topic, here's the paper, read it, sign the paper here that you did your in-services. Or did you actually provided them with the right training so that they can actually use that? So one thing that we suggest is you need to be able to make a classroom-style training program with policies and procedures for everything, right? So when we are teaching the team about dementia, we actually have a plan on how to teach it, right? Why is it important? What are the subject lines that you need to know? How is this important for our patient? How is this important for our company, right? You need to be able to have a policy and procedures regarding training and in-servicing your team. I guarantee this, if you're certified by CHAPS or JCO or the health department in your particular state, you do have a policy and procedure somewhere in there about in-services and how frequent you should do in-services. But if I ask you right now, do you know those policy and procedures? Okay, so you need to be able to make sure you see that. One of the largest tags that agencies get during surveys is regarding their in-services, that they're not providing proper in-services. And so we have to understand that training is important. Our marketing team, when we deal with our marketers and show them how to market them, we make sure that we provide them training nonstop in a variety of different ways, right? Improving and advancing the skills and professionalism of every person in your company is an ongoing process. And formal training sessions should be regular and non-negotiable. It should be part of the company. You want to keep your job, you need to make sure you need to finish this month, that month, and so forth and so forth. And you need to be able to have a plan of what they need to be able to re-updating themselves. And this includes the DONs. This includes the supervisors. Just because they have to make sure that the team is actually learning something, that the team is getting their in-services, they too must be getting in-services as well to improve themselves, right? And you need to be able to make sure that this is provided for everyone in your team. Okay, so let me ask these questions. Let me see if your company passes this test. Does your company pass this test? I'm going to ask several questions, right? Are all your employees, all employees, do they perform each aspect of their job with a high degree of excellence and consistency? So then, if your answer is yes, my question is, go ahead and define to me, what do you mean about excellence and consistency? And if that is your definition, give me 5 main things of what considers excellent and what's considered consistent. Okay? Now, from there on, go ahead and tell me how can they actually improve their excellence and how can they improve their consistency. Now, if you actually had an answer for how they can improve being excellent and how they can improve in their consistency, that means that what they're doing right there and then is not excellent and is not consistent yet. Because excellence is in the high rating of things, okay? So if there's always room for improvement, then something is not done consistently and is not done with excellence. Because those are pretty much perfect things or perfect terms or always terms, right? And there is nothing that is ever called always. No one ever does things always, okay? And so we need to be able to make sure that we actually target that, right? Let me ask this question. Are the results are somewhat predictable because training and skills are consistent? Like, can you actually, right, predict that they're gonna accomplish something in a certain time? And if they're not, if it's non-predictable, if your nurses, you cannot predict that all your nurses are going to visit each one of their patients on time, then that's something that we need to work on. Do each of your supervisors give a similar answer for each questions or problems? Meaning that there is that one policy and procedure and this is the solution. Or here is a good question to ask. The next question is each employee would give a similar answer for each question or problem, right? So we're asking, are the supervisors giving the same answer in questions? Are the employees doing the same exact thing? So this is the simple test right here and then. What's your mission, vision, and values? Ask each one of your employees that. If each one of them cannot even answer that question, they don't even know the core story about your company. Everyone in your team must be willing and must know the mission, vision, and values. That is the basic core of your company. And if no one knows it, or each one has their own individual assessment or idea what it is, and it's different from what is written in your board meeting, in your CHAP certification folder, your JCO certification folder, then that's something that you should start on. And then from there on, ask each employee certain different things. How do we handle patients that get admitted to the hospitals? Does each one of your employees have the same exact answer on regards to what step 1, step 2, step 3, step 4? Your supervisor should know all those answers. And if they don't, then we need to work on that. But if the supervisors and managers know, but then your nurses can't answer it, then that's a problem as well. Then the next question is, do you treat all your clients similarly, no matter who they are, whether it's one of those doctors that are really mean or one of those doctors that are super nice? Are all of your staff members, do they know what is considered good performance or attitude? When we do the yearly survey of each employee and we say, it's a good performer, does great at this. What is great? Go ahead and tell me what you mean by great. Go ahead and tell me what do you mean by good performance. Don't just tell me you're a good performer, break it down. Tell me what are the 10 things that you need to do to become a good performer. Because if you can do that, then you can tell and show a person how they can become a great performer, not just a good performer. So if you can answer all these questions correctly, meaning your employees can do this, your supervisors can do that, then you guys are doing an amazing job. But if there are certain things from the questions that was made just right now in this slide that can be worked on, then let's go ahead and get started on working on that and find a process to be able to make sure that we actually do it. So let's not have people making up what they're going to do in a crisis or in any other situation in your company or department. Have them know what to do in every situation because you addressed it weekly or monthly or quarterly, but depending on how important that particular subject is. Like I said, in the previous slide, we talked about, what happens when a patient gets admitted to a hospital? Does everybody know the steps it needs to handle? Does everybody knows when to call the physician, when to call the person in charge of the patient, when to call the hospital, who to call in the office, who should be emailing this thing, who should grab the information and follow that up with the hospital so the hospital has the information. Because guess what? If a patient ends up in the hospital, I want the hospital to know that that patient came from my agency because I want them to refer that patient back to me when that patient is done. Okay, so you need to be able to constantly teach the same information again and again until the skill is permanent. How do we do this? Through practice, drilling, and rehearsing. So with our marketers, for example, we make sure that we say, hey, this is the scenario. We have the top 20 scenarios that we go through with our marketers. How do you handle this when a physician says that? How do you handle when a social worker says that they're already using another agency? We need to be able to make sure that each of the team has the subject line ingrained in their head so they know how to be able to handle certain objections or blockings or problems, right? If you face a gatekeeper, every one of our marketers should be trained on how to be able to handle when the gatekeeper says the patient or the social worker is not in today or the social worker is busy, right? Do you have, right, things that are in place, policies and procedures that are in place to be able to handle certain situations? This is what we do, right? We work with agencies and give them the policies and procedures that they should have in place, scripts that are ready made for their marketers to know how to respond, how to handle certain things, how to handle problems, how to handle the follow-up, how to be able to make the right phone calls, how to be able to talk in the phone, who they need to speak to. If you guys don't have policies and procedures set forth when you are trying to do a particular part in your business, in your company, and the worst thing is having policies and procedures but then not being followed can create so much problems. We don't want people to say, yeah, I know the policy and procedure for that. Great. Show me, don't tell me. Show me, don't tell me. If you can't show me that you can do it, how do I know you're going to do it when you're in the field, right? And they're saying that they can actually insert an IV, but then can't describe to me how to do it is a problem. But no matter what, they may be good at teaching or describing how it is. Show me that you can actually do it. Those are the things that we need to be able to do. So when you guys are out there, you need to have and create the need of people to be trained properly so that they know how to handle things in the public, in the field. When I'm interviewing a potential marketer that wants to work for me or a marketer that wants to work for an agency, we're going to ask them a question and put them in a spot to say, hey, you're facing this, how would you handle this? Right? So these are things that you and your company needs to put together. Okay? So constantly teach the same information again and again until the skill is permanent, right? Because practice makes perfect. There's that study that says if you do something 10,000 times, then you're going to become a master of it. Well, how do you become a master of it? Well, you're practicing always. You're training yourself always. You're drilling yourself always, right? Basketball teams will practice plays nonstop so that they can perfect it when they're playing a game. Football players are going to make sure that they know what they need to do when certain things happen, so that when it happens in the field, they know how to be able to handle that, right? So if you're thinking about starting a training session, people should be told what to expect, what's going to be covered, how long it will take, how the information will be covered, the objectives of the particular session, the obtained skill and knowledge you hope they will gain, right? So when we're telling people, hey, we want you to watch this 10-minute video because it's going to show you how to be able to make the first stages of marketing into a nursing home. It's going to take you 10 minutes. This information, you're going to be able to learn from it. The objection is for you to be able to take the knowledge from there and apply it in this field, okay? And so this is something that you're going to be doing every time that you visit any nursing home or any potential referral source that you're trying to target. So you need to be able to constantly teach the same information again and again until the skill is actually permanent. And then when people have a clear understanding of what they are about to hear and see, they will be mentally prepared and focused for the training. So we retain the most information if we are actively involved, role-playing or other learning exercises. So it's good to mix a few methods, right? Lecture formats, group discussion, demonstration training, role-playing. I'll tell you guys one thing, working with marketers for so long, the role-playing part is one of the most important things, is because I need to see, can you actually do, and show me that you're going to do this when you're in the field. You can't just tell me, well, I know how to talk to physicians. Okay, great. Here's a scenario. I'm a physician. You walk in. Okay, you walk in, say, hi, my name is so-and-so. Great. You said that. Then I'm going to say, you know what? I'm busy right now. What's your answer, right? Go back and forth. Play the role-playing game. It's such an important training part when you're doing marketing, because we need to be able to handle these things and know how to be able to deal with it, right? Test before and after. See what their skills are in the beginning. And then after you show them the training on how to actually talk and handle objections, see if they learn it. They can actually demonstrate what they learned. Spot quizzes. We'll call certain marketers at time and say, hey, I'm busy right now. How do you respond? And the person needs to, within a snap, answer and return the answer that they need to do right there and then from the training that we did before. Okay? These are small things that we want to be able to make sure that is learned. Workshop training is also important. So sometimes, I'm sure that you've attended seminars and events. So, one thing that we do in Home Health Success Academy is we have our online learning platform where, you have a membership and you can watch all the important videos you need to learn to be able to market your company. But we still have live bootcamp events to be able to have somebody in front of you live that can answer all your questions. So what do you guys do in order to be able to make sure your team is trained and knows what they need to be able to handle? So, I hope this part, does you guys well, and I hope the information you guys have here can be used and should be used actually. So you need to start creating a training program within your organization to be able to create success for your company. And if your company can't do the training within the organization, then you should be able to go ahead and delegate it outwards. If it's marketing, give us a call. There's other companies out there that can also help you. But we're here right now. We want to be able to help you guys out. If your nurses need to learn how to be able to code properly, send them to coding camps. There's several companies out there that can provide that training for them, whether it's online, whether it's live webinars, whether it's live boot camps. What can you do to always make sure that your team is educated? A team that is always educated and continuously are learning are the ones that's going to become successful in this industry, right? A lot of companies had problems in Illinois when they had, the pre-approval thing happen, because a lot of agencies weren't ready for it and they didn't train for themselves. So they created a lot of problems for them, right? And so what are you guys doing right now to address things? It's about being proactive than reactive, right? You can't react to everything that comes in front of you. If you're proactive, you already know how to handle it. And that's what training is important. Education before things occurs. If you know how to handle things beforehand, when you face it, you know that you can actually instantly respond to that right there and then. So I hope this video helped you guys out. Always understand that Home Health Success Academy is here for you, and home health marketing is easy when you guys know what you're doing. If you have any questions, give us a call, 863-333-6050.